Hi, Dr. Charlie, professors, and viewers. Good day to you. My name is Rina from Birmingham City University. My BCU ID is 22245032. Kaplan ID is CT0368302. The module title is Innovation Thinking for Organizational Development. Today, I'm presenting my innovative project called Healthcare Cost Containment Program. According to the Health Promotion Board, 1 in 4 Singaporeans aged 40 years and above has at least one chronic disease, namely diabetes, high blood pressure, high blood cholesterol, and stroke. A local study has found that the proportion of older adults with 3 or more chronic diseases nearly doubled from 2009 to 2017. Based on an ongoing survey of more than 4,500 Singaporeans and permanent residents, more Singaporeans aged 60 and above are also having difficulty carrying out daily living activities. Although the Singapore government is actively involved in ensuring affordable healthcare primarily for low to middle income families via CPF or insurance and promoting healthy living through Health Hub or the Health Promotion Board, the two are not combined. Instead, it is a standalone issue that needs to be solved individually. I sketched the first scope map to help me visualize my thoughts and see what changes needed to be made. After multiple iterations and initial desk research, eventually I came up with a desired draft. I employed the 6 stages of design thinking process by empathizing the situation, defining the problem statement, ideating a range of interesting ideas, developing prototypes, test repeatedly, and implementing the product. With that, I started off the first stage of design thinking process by gathering a group of people who works in the related fields and having relevant backgrounds and concerns. I used the Toyota's 5 whys technique to iteratively interrogate the cause and effect to define the underlying problem. To my surprise, the root cause is completely unexpected. The problem is high medical costs. Why? Because operating cost is increasing. Why is the operating cost increasing? Because of inflation. Why is there inflation? Because of medical advancements. Why do we need medical advancements? Because of aging population. In my early introduction slides, I shared that the study shows older people tend to have multiple conditions, and that requires more medical care, procedures, and longer hospital stays. With advanced medical treatment, it protects the healthcare system. Why is there aging population? Because of rising life expectancy. I was enlightened with the root cause. With the 5th why, I realized that the root cause of rising life expectancy is a problem to high medical costs. Hence, stay healthy is definitely non-negotiable, as the saying goes, happiness begins with good health. Therefore, the final problem statement that I defined was how to reduce medical treatment costs and stay healthy at the same time. Together with a focus group, we formulated a list of survey questions to ideate key objectives and solution designing. I used the Scamper method to generate innovative solutions to problems. For a substitute, instead of going to the doctor, the patient can consult the doctor virtually through a mobile application and have their medication delivered right to their door. For Combine, instead of using the application purely for consultation, I combine it with various activities such as nutritional diet advice, working out, and webinars. For Adapt, I do not want to restrict users to those who only speak English. Instead, I included multiple languages to improve the usability of the mobile app. For Magnify, to give the mobile application more meaning, I added health trackers such as measuring blood pressure, generating health reports, and knowing how much has been saved. Put into another use. Based on the root cause identified through the 5 Whys techniques, I should not limit users to the sick, but rather to offer affordable healthcare and programs to everyone. I eliminated the third-party administrator to remove the additional fee. Service providers can join the platform directly. For Reverse, instead of consultation, the primary purpose of this mobile application is now health programs such as nutritional diet advice, workouts, webinars, and tracking of health conditions. Reason being, health programs can be used daily, but consultation is not. I used the value proposition canvas created by Alex Osterwalder to map out the customer profile to understand what my customer wants and the value proposition to describe how I intend to create value for my customer. My value proposition is successful when my product and market research align. And I went on to sketch a low-fidelity wireframe to visualize what the application should look like. Then, I transfer it to a medium-fidelity wireframe for a realistic typography and grid systems. I also added some ideas along the way. I presented the low and medium fidelity wireframe during a focus group session for a holistic view. The feedback session was extremely fruitful and constructive. With that, the Live Healthy prototype was developed. Final testing was done to ensure it works positively, and I tweaked some ideas before meeting large organizations for pitching. I was extremely pleased to gain partnership with various large organizations, which includes government bodies and private organizations. The reflection of the entire design thinking process. When it comes to the strength, users can easily access to lower cost medical treatment from the comfort of their home by scheduling an appointment from any location, whether is it for a medical appointment or to attend activities. In addition, the app uses artificial intelligence to learn, study, and recommend the best nutritional diet advice, workout, and webinar based on their medical conditions and current health. The application also generates a health report to help them inform about their overall health status and displays how much money they have saved. For weakness, developing and maintaining mobile application can be quite costly, being that the features must be engaging, user-friendly, and constantly upgraded due to the rapid pace of technological advancements. Data security can be quite vulnerable, as evidenced by large corporations being hacked. As a result, data protection is critical to ensuring no leakage. How can researchers improve on my innovation? Researchers can constantly solicit feedback to improve the interactiveness and ensure that users are committed to living a healthy lifestyle. With larger budgets and partnerships, incentives could be considered to entice users to stay current with trends, make wiser business decisions, and sustain a company's competitive edge. Thorough research is required. The entire process began with how I came up with this idea, reiterating the problem statement and scope map, using the design thinking process and scamper method, which assisted in organizing my thoughts clearly. The product became more purposeful with each focus group session, as it was part of the ideation process to improve and eliminate what was unnecessary. Another method for ensuring product and market fit is the value proposition canvas. It is even more rewarding to able to put my idea into action and see it through to completion. As a result, I look forward to seeing more users helping everyone become healthier and seeking less medical treatment. I'm also hopeful that this application will be expanded internationally. That brings my presentation to an end. I hope you will be one of my users someday and become even healthier. Thank you.